I am Dr. Paul Karpecki. I practice in Lexington, Kentucky. I'm Director of Cornea Services. I also see patients at Gaddy Eye Center in Louisville, and I'm an Associate Professor at the Kentucky College of Optometry. Clinical focus has been cornea. I was lucky to do a cornea fellowship in 1994 under Dan Dury, obviously a very extremely well-known top cornea refractive guy. It was a great launching point, stayed in cornea ever since. And I've been very fortunate. I've worked with some of the top cornea specialists around the country. Now in Lexington, that's kind of my role, medical cornea, and that still is. But with that, I'd say I have a sub-focus of ocular surface disease and dry eye. Yeah. You know, the key to treatment options is obviously to get the effect you need. And it's not that easy. People always think, oh, dry eye is going to be simple. It's, simple disease like chapped lips. And I'll tell you, it's probably the most complex disease I've ever treated. There's just so much that goes on with it. So the key to achieving success is you have to have symptom resolution, because patients will not, notice that their signs are improved or notice that you're getting an improvement, but you also have to have sign resolution for our sake. So it is a combination of both symptoms and signs. It's rapid, it's definitive, and it really does depend on when the disease is first picked up and what you're treating. But overall, as all of us would say, we want the patients happy, and we want to see that what we're doing is having a meaningful effect. Yeah, the general thoughts on cryopreserve versus dehydrated formulations is that the cryopreserve maintains a lot of the essential components that are necessary for healing. It also has the research. There's lots of scientific sources to show nerve regeneration, for example, which we cannot see with any other form of amniotic membrane. But more importantly, besides having the science and besides having the studies and the FDA designation, the big factor for me is just clinical experience. There are conditions on the ocular surface that you clearly can see the difference. Now, there are differences. Obviously, when something is cryopreserved, it's going to maintain key components that we know of. But I think ultimately it's what we see in clinical practice, and that's where we're seeing significant differentiation. There are conditions that nothing else will work on. You have to go with amniotic membrane. And the response also from patients is quite dramatic to it. So it has a lot of benefits, both scientifically as well as clinically. The question about wow moment is tough, because I tried to think of that and I realized I got a whole bunch of wow moments. I'm going to actually give you three, and I know that's kind of hogging a lot of the time here, but I couldn't narrow it down to one. And part of the reason is the very first one I ever did was a wow moment. I remember a patient, he had I believe, I got to go back as a record, but I think it was HSV, neurotrophic keratitis with a persistent epithelial defect. He'd been through the clinic, seen all the other doctors in cornea at that time. It had been bandage lens, pressure patch, lubricants, you name it, inflammatories, punctal plugs, you could do it. And 28 days later, it still looked the same pretty much as the original pictures. This is my very first one. I thought, what an opportunity, let's put it on there. Saw the patient back at 3 days. I honestly believe it was healed, but since it was still intact, I said, let's keep it in there. Left it in there till the end of the week, so about 5 days, removed it, 100% re-epithelialized, and great vision, great recovery. It just showed me right away, there's nothing like this. We had tried every possibility. But then I've had other wow moments. One that really stands out for me over time is one that's common that you don't think of, but it was because it's interesting. This lady came in this past December, wanting to have a premium IOL, terrible ocular surface disease staining. Showed up with a flex plan money she had to utilize, had been saving the whole year on December 12th. So we're sitting, we don't have any more surgery days to do this. The patient cannot wait till January to use her flex plan. One of the surgeons I work with, Evan sends the patient over, says, I need your help, but I need to fast. I thought, wow, that's grade 4 SPK. 2 eyes we got to take care of in this time. She didn't give us a ton of opportunity. Let's try Procera. Fit, it was chronic, significant. She was neurotrophic to some degree, but it was really severe KCS. Motivated patient, so fairly young. Fit the Procera, removed it. I kid you not, that staining by someone went from 4 to practically nothing. Had surgery, did the other eye, 2020 OD, 2015 OS. Amazing. We still talk about that case. And then one that's really impacted a patient's life for me was a police officer. He was a young guy too, like in his late 30s, had at least 10 bouts he recalls of herpes simplex stromal keratitis with a significant amount of eggs. His vision was about 20/30. That doesn't seem terrible, but his night vision was probably far worse than that, maybe even 20/25, but night glare, easily 2100. He said, I can't keep my job. goes, I'm going to have to give up on the police force because I'm not a desk job cop. I can't sit there and do my work. It's just not me. I got to be out there, but I can't protect my partners, can't protect society. You're my last stop. He's referred from one of my optometric colleagues. And I said, well, good news is this is very superficial. Amazingly, for 10 bouts of HSV stromal keratitis. And I thought, well, let's give it a try. We placed that on him. The day I removed it, it stayed fortunately for about 6 days, gave me a little extra effect than the usual 4 or 5. I think that helped. But the other eye, I tell you, the other time patients like that have done it in 4 as well. So this is very amazing technology. That being said, 2020 on removal, 2015 a month later, 2 years later, he's still on the police force doing everything, raves about his vision. So it'll surprise you with cases like that I gave him a 10% chance of improvement. So I know it's a lot of cases, but exciting technology, well deserving of wow moments, and I have a bunch of them, as do most doctors who use this technology.